Personally, I hate going to the dentist, and I'm not the only one. Of course, I know that good brushing habits lead to reduced tooth decay, gum disease, and decreases the chance on serious health issues. Brushlink's solution combines data with technology to help me with that. It is set up in an easy to implement way, as it can be combined with any toothbrush and by using an app. By working with Brushlink, insurance companies provide a real added value to customers while reducing claim costs. Please welcome Brushlink.
Good morning, everyone. I'll just take a seat here. For those of you I haven't met, my name is Nuria Powell. I'm one of the project directors here at ITC DIA. I'll also have the honour to arrange the London event that we're launching in January. So if you haven't already heard about that, feel free to come and ask me, but you're not here to hear about me. I have the honour to be interviewing Nazar from Brushlink. I think we're just going to start off with a quick video about Brushlink so you can just understand the company before we get into the interview. So if we can play the video now, please.
Unlock the full potential of Brushlink by using it with your patients. In just a few quick and simple steps, you'll be able to set up their new device and attach it to any type of toothbrush. With Brushlink, you will now be able to visually demonstrate correct brushing techniques and tailor brushing habits to help improve your patient's oral health. Using our customized Brushlink software for the first time ever, dental professionals will have access to real-time brushing data for all their patients. You can not only view each patient's brushing data, but you can also tailor brushing regimes to ensure your patients do not forget the advice you have recommended. Patients will accumulate points for good brushing and will be able to redeem those points for rewards. It can also be tailored to your practice with your name, address and opening times. We have lots of patients already using Brushlink and they all have given amazing feedback, along with our clinical evidence showing Brushlink will improve plaque scores compared to patients who don't have Brushlink. Brushlink, join the revolution.
Wonderful. So with that introduction in mind, I would love to ask my lovely interviewee to please introduce yourself and tell us about your vision, please.
My name is Nazar Kamangar, and I'm the CEO of Brushlink. My pleasure to be here today. So our vision is basically to create the most efficient and affordable data ecosystem for consumers and to learn how to brush in short term, changing the behavior, and in long term, billions of dollars of saving in our healthcare system around the world and improving the overall health.
Amazing. So what is the specific problem that Brushlink has been created to solve?
We're trying to solve many problems. One of them is the impact of poor brushing habit is going to impact on overall health and your heart, kidneys, etc. Right? So, the starting point is how to educate consumers that we don't want to get to the last minute when they really don't do anything about the oral hygiene, right? And then the second is how we are going to provide data, because when we go to the dentist or hygienist, we don't really get any digital data. And I think that is the other problem that we're trying to solve, to provide metrics to the consumers every time that they go to the dentist and hygienist, how they can get metrics, digital record that they can check it another time to see if that was improved or not.
Great. I mean, obviously we're at ITC DIA insurance event. How do you see Brushlink being able to help insurance companies?
I think insurance companies can leverage Brushlink in many matters. For example, one is aggregated data, right? Everybody's looking for data, but how we can utilize Brushlink data and then aggregate that with other or healthcare datas that they can communicate between physician and a dentist if you have a cancer patient, diabetic patient, and how you can improve the overall health that is going to start with our mouth. And the second is really insurance companies are looking to save, right? Save money, and the same thing as government or consumers. But that has to come with education, right? And this is kind of the educational platform that smart devices are going to provide. And with that, insurance companies can change the behavior of the members, and in long run, they can save the cost.
Amazing. And obviously, you're mentioning the data around brushing being of paramount importance here. What sort of role do you see brushing data taking in the overall healthcare data ecosystem?
I think in the future, the dental medical integration is going to be one of the ways to go. We all go to the doctor, we have lab results, for example, right? And we have the digital record for that. We can go back and take a look to see what was H1C, for example, before, what was the blood test, the cholesterol, etc. But there is no way right now for consumers to know what was the status of my gum 5 years ago, right? And if you want to know anything specific about the tooth, you know, what happened when the cavity started, when you have the bridge, etc. So those are the information that is going to be extremely useful. And I think that is the future, to integrate digital oral health records with the healthcare.
Amazing. Yeah, I'd love to know what the state of my gums are, but I have no idea. So obviously we mentioned what Brushlink can do for insurance companies, but what is the kind of business model for a partnership with an insurance company?
So the starting point is the smart devices that we came up with 3 types. One is the external device that you can use for manual toothbrush or any power toothbrush. And the second one is the same technology that we adopted for dental manufacturers, because the idea is, instead of saying we have Oral-B or Philips or others, what's the best way that everybody is going to benefit, right? And then we came up with a plug-and-play solution, which is integrated chip technology. With that, then everyone can get to the standard data for insurance market. And the third product is going to be the gamified solution for children, that parents do have the opportunity to see if the children really brushed and how they improve the brushing. And the last one is going to be the AI dashboard that dentists and hygienists are going to have access to the brushing habit, and they can customize that for the patients.
Yeah, I remember fully looking my parents in the eye and lying about the fact I brushed my teeth, and they made me blow breath on them, and then they sent me off to do it again. So now I could see how that could be very helpful for parents. So what is the kind of overall dream that you're working towards here? Obviously, you're working very hard, but what is the ultimate dream here? My dream is to have all the children around the world to learn how to brush in the school with a technology platform that is going to be affordable. And I think education has to start with early ages. And that's my dream to come true, to see we have children and the parents, that they can learn a technology that can help them for their overall health. Amazing. Yeah. What sort of suggestions do you have for corporates, VCs, private equity firms to kind of help support in making this dream come true?
So in my opinion, we are really looking at ethic, right? Because you're looking at early ages, and everybody's looking for change of behavior, right? And the change of behavior can start with early ages. It's easier than when you're getting older. And then we have technology startups that they are disrupting the model, right? So I think if the approach is going to change from the corporate venture arms to VCs and private equities, for example, in the US now, it's very hard for the dental offices to be acquired. And then dental support organizations with more than 1,000 locations is very hard for the private equities. But if you really think about these dental clinics are going to have digital record that they can share, the consumers, the patients can share when they change the job, when they change the employer, when they change the insurance companies, they own the data. That is going to be really the highest ROI that private equities can have. So creating VC arms or strategic investments, I think, would be beneficial for all.
No, brilliant. Is there a particular oral dental manufacturer that you think would specifically benefit from Brushlink and your partnerships with insurance companies?
If you're looking at the market for the smart toothbrushes, or let's say power toothbrushes in general, Oral-B is the leader, right? So I think in this market there is a lot of room for other brands to grow. But if you really take a look to all of these brands for the dental manufacturers, none of them are really playing a major role in the insurance market. And the reason for that is the standard data. It's very hard. And what we did is we created a plug-and-play solution for all the manufacturers that they can easily get to the insurance market volumes. So Philips, we're in Netherlands, and I think Philips is behind as far as the market compared to Oral-B for the power toothbrushes. That's the opportunity right there. And there are many others, like if you take a look to the toothpaste companies, for example, Haleon or Unilever, they have a toothpaste, but they don't have a smart toothbrush. So this is the opportunity for them to have a white label solution and get into the market and have value added. So in addition to that, I think Align Technology Invisalign is going to be one of the candidates, because everybody is really caring now about the smile and having the teeth straight. There are volumes that they can get in, and people are asking, when I have braces or when I have Invisalign, how should I take care of my teeth for the oral hygiene? So these are all related, and I think this is going to be something that we can create a very unique ecosystem that everybody is going to have benefit.
Yeah, amazing. I had braces myself, and the time I want to just absolutely remove from my memory. But yes, it would have been helpful to know exactly how to take care of my teeth at the time. I was very worried it would rot around the braces and then all sorts of horrible things. So I definitely see that being a benefit. But obviously you're mentioning a lot of European-centric companies and business strategy. What is it about the European market that makes you particularly interested in the region?
So Europe is really interesting market, in my opinion. Like if you really take a look to United States, the cost for a crown is average 1,000, right? And if you take a look to the G7 countries, you'll see, for example, Italy has 1/3 of that cost, right? In UK, the cost is like second compared to United States. After that. But there are a lot of government funding in Europe that we are hoping that we can help the government, the taxpayers, when people learn how to brush, the preventive care is going to come. And eventually the consumer is going to save, the government is going to save. Because to the best of my knowledge, there's absolutely no insurance available that is covering 100% cost of the dental. And one of the reasons that poor oral hygiene is going to impact on the overall health is because people don't have the money, or they don't see that as a priority to take care of that, and they wait and wait until it's going to be too late, right? So I think Europe is very interesting. Each country has a different culture, but we can help the healthcare system to save money and then improve the overall health in general.
Amazing. So it sounds like something that health insurers, whether they have a specific dental side, should be really interested in investigating, because it's not, teeth aren't just teeth, they will impact overall societal health. So no, I think that's a really interesting point too. I believe we just have a video now from Professor Liz Kay that we can just have a quick look at, and then we will close off the discussion.
Sure.
So yes, if we'll just have a quick look there.
Hi, I'm Professor Liz Kay. I'm the Foundation Dean of Peninsula Dental School. I'm a Professor of Dental Public Health, and I'm also the President of the Oral Health Foundation. The paper's about Brushlink, a new device, and its application to two of the most widespread human diseases, caries and periodontal disease. Brushlink is a small attachable device which you attach to your toothbrush, and a mobile application which can be used on any smartphone. The device uses Bluetooth technology, and it's got a magnetometer, an accelerometer, and a gyroscope, so it knows where it is in space. It can be attached to electric or manual toothbrushes, so it can be used by any age group. What it does is give people real-time guidance on their toothbrushing, whether they're covering every sextant of the mouth, every tooth surface, whether they've got the angulation right, and whether they get the duration of toothbrushing right. So for the first time ever, dental professionals can give real-time guidance to their patients about their oral hygiene. And through a cloud-based system and Brushlink, they can give particular guidance that's tailored to the individual. The Brushlink device boosts people's will, their drive to brush their teeth well, and their ability to do that. We tested it in a randomized controlled trial, and we showed that what Brushlink did was dramatically reduce the plaque levels in people's mouths. The paper's very important for two main reasons. I happen to be the author of two of the major reviews of oral health promotion. So I know that what we showed in this randomized controlled trial was that Brushlink has twice the effect of any other oral health program. The second reason that the paper's important is that it's given us, for the first time ever, a means of measuring what people do and how they behave towards their oral hygiene every day in their own homes. Previously, we've always relied on self-reports to assess how people are doing with their oral hygiene. So Brushlink is potentially a really important research tool. So the next step is for us to run another trial over a long period of time so that we can assess the long-term health benefits and the cost savings that can be achieved by improving people's oral health. So if you want to have a look at this paper, please go to the British Dental Journal website, and that's at bdj.co.uk.
So I think we're almost out of time, but I will just say I'm sure Nazar would be more than happy to answer any questions that any of you have about a potential partnership with Brushlink and what that could mean for your sort of overall the health of your customers. And likewise for me, if you have any questions about London 2025, feel free to come and ask. But I can only thank you very much for your time. I'll certainly be paying a lot more attention to how I'm brushing my teeth tonight, if nothing else.
Thank you for the opportunity. Yeah.
No, absolutely. Thank you very much. And thank you all so much for coming. Please give Nazar a warm hand.
Thank you.